Yeah. So how do we build a brand? What kind of techniques does Practice Growth Partners use, or philosophy, in a multifactorial marketing proposition, which is digital brand making, to prop up a telehealth business, whether it's in primary care, in mental health, or aged care models? How do we differentiate a platform from the other one?
Okay, so what we are doing in PGP, or Practice Growth Partnership, is, first of all, recently we launched our own project management, platform. So private, secure, so you are not dependent to the other, because there's a lot of secure and private information, privacy policy things. So we need to just save everything in a very secure Australian cloud hosting. So that's the first thing that we started to do. And all tasks, everything related to the password, whatever, clinics is there. That's one thing that we did. Another thing that we are doing, we are really customizing AI for each scenarios, for each clinics. And we are trying to find all automation path. And then based on those automations, we are, kind of customizing AI for those business. But another point that differentiate us is we are not just implementing automations. We are starting to change the infrastructure of that business. So even you're expert on AI, even if you're expert on automations, without proper infrastructure, you cannot run AI properly. So you need to have a very good website, very good hosting, very good server. So what we are doing is not just marketing. We are very good at marketing. There are many other good companies as well, no doubt, but we know zero to hero. So we know basic things like, the infrastructure, first level. Yeah, exactly. Hosting, security, firewall, all of those. And also we are capable of understanding medical things, which I know your business is really doing that well. So we are connecting these two together, and you're adding marketing as well. So it's not just, I know when we are talking about brand marketing, so what's their needs, what's their problem, the value proposition of those business. So I'm just passing those. Everyone is doing that. Everyone is doing that. But we are not just talking. So we are implementing the real situation, the real scenarios. And we sit together with business, understand, the problem. And in some cases, we are building technology for them, like the project management that I said that. So we are not just using available technology. I'm not saying we are inventing a wheel, but in some situation, in some cases.
Might have to invent a little wheel.
Exactly. That's what exactly we need to do.
In order for the business to function.
Yeah, otherwise they were working very well.
It's harder to change the way doctors do things. So therefore, we want to build an intelligent system around their comfortable style of medicine.
100%.
Because they feel comfortable and more efficient in their own way doing things, especially some doctors take notes differently. Some doctors use sort of recorded or AI tools to transcribe, and everyone's functions differently. But therefore, ability to customize that is not a one size fits all. We want to scale up what works for them, because that's essentially what makes the engine run. And seeing patients and billing them, how can we do it more efficiently? How can we use all of these tools to give the patients an ultimately fantastic experience to get.
Yeah, exactly. And also, this save a lot of time for them. And sometimes, I'm talking to doctors. They ask me, so what should I do with my admins? I hired many people, so what should I do with those people? And actually, surprisingly, AI is not just removing them. So what will happen is they can assign them to different tasks and enhance their business. They can get way more clients. They can manage more tasks. So as I said, that AI do a lot of things and then reach and get to the point that admins can continue from them there,
So therefore, more scale, more capacity.
Exactly. That's what's going to happen.
AI and a person can be 3 persons.
100%. And I am hearing all the time that AI is going to replace people. AI are going to get the job. First of all, I don't think we are on that level. So we're talking about generative AI, which people think generative AI can, knows everything. So basically, generative AI is using pattern, find the best suitable answer, and show it to the users. So that means AI is not still understanding what's going on. That's why AI fell to the hallucination situation. That's why we are inventing or building grounded AI, which AI that we are controlling to not let AI fall into the hallucination process. So at this moment, AI is not replacing anyone, not even very soon. But if you are a person who are not using AI, definitely those people who are using AI are going to replace you, no doubt. So the sooner the better. So you start integrating AI and automation in your systems.